patient participation and partnership in their surgery preparation and recovery improves their outcomes by decreasing their postoperative complications and their actual length of stay in hospital. Meet Kelty. She's recently been diagnosed with colon cancer and she needs surgery. She wants to know what to expect before, during, and after her surgery. And she also wants her advocate to know so that he can help her along this journey. She's just been to the pre-op clinic to see me, and the information I have provided her is overwhelming. We've developed MySurgeryPal to help reduce the information noise, to assist her in preparing and recovering for her surgery.
So what you see up here is our login screen. I just need to enter a few key elements about who I am, my contact information, my advocate, the type of surgery I'm having, and the date and time. When we submit this screen, we'll go into the MySurgeryPal application and see a customized plan of care that's patient-based for me. We'll have the check marks down the side that show what's already been completed along the pathway. And if we go into something like Plan Ahead, we can go back and look at information we already reviewed. This takes us and links us to the My Health Alberta information that's already populated out on the web. You'll also see that we have a notification called Stop Eating. That actually sent me an email about 3 or 4 hours ago to tell me that it was time for me to stop eating 8 hours prior to my surgery. You'll also see something that says Stop Drinking. I just got a text message right before I came up here telling me that I'm 3 hours pre-surgery and I need to stop drinking anything. This is great because I'm not always in front of an app and I'm not always in front of my big stack of papers, and it helps me know that I need to stop something right away. There's also post-op information there because we've learned that that is key for good patient outcomes. So to remind me and my patient advocate that we need to chew gum, I need to get out of bed, and I need to notify my nurse if my pain or nausea goes over 4.
Translating this opportunity across all elective surgeries in Alberta enables the system to streamline and standardize surgical patient education in the province. Even if we apply this to only 30% of elective surgeries in Alberta, it has the potential to free up inpatient capacity equivalent to about 8,100 bed days per year, or alternatively reduce the costs in the neighborhood of about $7 million per year. To move this solution to the next stage, we need Alberta Health Service executives to champion this, and we need approximately $250,000 to develop, test, and implement MySurgeryPal in hospitals across Alberta.
Are there no similar systems like this out in the market at all?
There's nothing that we've experienced that links the patient information that's developed within a health system and reminds patients in real time what they need to do and when. So linking the technology with the information. We literally give them stacks of paper today, or point them to a million different websites to get information.
And I mean, you're taking the paper-based system and then you're digitizing it, but are you going to make that pile of paper, easier to read and easier to understand versus just digitizing it?
Yeah, so that's what's happening right now. We're streamlining that process currently.
So can you tell us just a little bit about the pitch that you would give to the Alberta Health Services executives on why it is that this is in their best interest?
So we would do a bit more number crunching than we did this weekend. And we've actually got a lot of that number crunching underway. This dovetails very nicely with a project that they're investing in currently. And so we are already working on enhancing recovery after surgery in colorectal patients in about 7 facilities and looking to spread that across all facilities in the province. So this takes it to the next step. And so this small investment, we feel, will get even more gains than what we're already demonstrating with our current implementation with this patient population.
30 seconds. Any other questions? Okay, thanks.